So, one of some of the risk factors, and we're going to discuss those in detail throughout this presentation. What is a risk factor? A risk factor is the reason why someone is more likely to develop a cancer or disease than the average person. Some of the common risk factors for liver cancer include medical conditions such as hepatitis C, hepatitis B, type 2 diabetes, and obesity. Lifestyle choices such as diet, needle sharing if someone is an IV drug abuser, smoking, alcohol, and then ethnicity. We know that certain ethnicities, such as being Black or African American, can increase your risk of developing liver cancer.
What about liver cancer in Black or African Americans? Well, liver cancer is also known as hepatocellular carcinoma, or you'll hear people refer to it as HCC for short. And it's the most common type of liver cancer. And the number of people in the Black community getting HCC is really growing. So it's on the rise. We already talked about the fact that liver cancer is 1.5 times more likely in the Black community compared to the general population. But not only are we more likely to have liver cancer, but unfortunately, we're also more likely to die from liver cancer. So it has the highest death rate of any ethnic group. And African Americans are less likely to be diagnosed at an early stage of cancer. We're going to talk a little bit later about staging, but obviously, if you can catch the cancer earlier, then the likelihood of you surviving the cancer is better. Well, in African Americans, we tend to be diagnosed when the cancer is at a more advanced stage, meaning that our chances from dying of the cancer are higher. But even though I'm kind of telling you the bad news, there is good news. And part of the good news is that you're here today on this education. Good news for you personally, and then hopefully good news for other people in your circle. Because with education and taking control of your health, you can help manage your risk for liver cancer. What are the things that are making African Americans more likely to get a disease than other people? So some of the common risk factors for liver cancer include medical conditions, which we'll discuss through this presentation, lifestyle choices, which we'll also kind of go through, as well as ethnicity. And we've already said that being Black or African American is a risk for liver cancer. Hepatitis B virus is one that you may not be very familiar with, but hepatitis B is a virus that also affects the liver. It's transmitted more commonly through sexual secretions as well as blood-to-blood contact. So through transfusions, injection drug use, razors, anything where blood is in contact or sexual contact. And so African Americans are actually 2.6 times more likely to die from hepatitis B than non-Hispanic whites, which is interesting because we're less likely actually to get hepatitis B, although hepatitis B can be found in the Black community, but we are more likely to die from it. So chronic hepatitis B can lead to cirrhosis. So I mentioned to you just a few seconds ago that hepatitis C can also lead to cirrhosis. The idea is that these viruses infect the liver, and then you can get inflammation and scarring, and that scarring can become stage 4 scarring, which is cirrhosis. And that cirrhosis then replaces all the healthy cells and also becomes a risk for liver cancer. So cirrhosis certainly increases your risk of liver cancer, but hepatitis B is unique in that hepatitis B can cause liver cancer even without cirrhosis. So I mentioned to you before at the question that hepatitis C is associated with liver cancer, but that's usually through the pathway of cirrhosis and then cirrhosis putting you at risk of the liver cancer. Well, that can also happen with hepatitis B, putting you at risk of cirrhosis, and then cirrhosis putting you at risk of the liver cancer. But with hepatitis B, you don't necessarily need the cirrhosis part. You can go just from having hepatitis B to then developing liver cancer. So you certainly want to ask your doctor to screen you with a blood test for hepatitis B. That's the hepatitis B surface antigen. That's usually the test that we will recommend for screening for hepatitis B. And you also actually want to make sure that you're protected against hepatitis B, meaning that you have the antibodies to protect you if you were ever exposed. So that's hepatitis B surface antibody. There are vaccines for hepatitis B, and in fact, most kids who are born now are automatically vaccinated against hepatitis B. But if you're older, then you may not have been automatically vaccinated. So again, you want to make sure you talk with your doctor about getting screened and then also making sure that you're immune or protected against hepatitis B.
Another risk factor for liver cancer is hepatitis C. This is the leading risk factor for liver cancer in the United States. And even though African Americans are almost 2 times likely to die from hepatitis C compared to white Americans. Hepatitis C can be treated and even cured with antiviral agents. This can decrease your risk of liver cancer. Over 2 million people in the United States have hepatitis C. And with this disease, 50 to 85% of people who are diagnosed with hepatitis C will develop chronic hepatitis. Hepatitis C is mainly developed or spread by IV drug abuse and is often asymptomatic. Who should be screened? All adults should be screened at least once for hepatitis C. But those at greatest risk, IV drug abusers, men who have sex with men, long-term sexual partners of people with hepatitis C, patients on hemodialysis, people who have sex with IV drug abusers. You can also spread this from the mother to the baby during pregnancy, and HIV. Some of the symptoms for hepatitis C include fatigue, nausea, diarrhea, abdominal pain, anorexia, weakness, muscle aches, weight loss, dark urine, and jaundice. And this is treated with antiviral agents. And this can be cured.
Type 2 diabetes. I mean, Black Americans, as most of you know, are 2 times as likely to get type 2 diabetes. I'm sure we all know someone in our family and our families who have type 2 diabetes. And we often have more complications when we have diabetes for the same reasons. Often we may not be in care, or from lifestyle choices, how we eat, the types of food we eat, lack of exercise. There are a number of things that go into this, but it's not a hard sell for me to tell you that African Americans are more likely to have diabetes and more likely to have complications from it. And studies have shown that type 2 diabetes is linked to an increased risk of liver cancer. But type 2 diabetes is a risk factor that we can try to manage. We can try to manage it by managing our weight, by managing the types of foods we eat, by making sure that we're in good communication with our doctors and following up on our medications and making sure that we're compliant with medications and making sure that the diabetes is under control, that hemoglobin A1C, which is a measure of how well your diabetes is under control, is truly under that 7% mark, if not lower.
Another risk factor for liver cancer is obesity. And this is one thing we can control, even though we may have a hard time controlling it. If you don't know if you're obese, or if you're just carrying a few pounds, it's important to know that obesity has a clinical definition. Either body fat percentage for men greater than 25%, for women greater than 33%, or the BMI or body mass index. This is regardless of gender. If your BMI is above 30 kilograms per meter squared, then you're considered obese. If it's above 40 kilograms per meter squared, you're considered morbidly obese. You can talk to your doctor about finding out your body fat percentage or BMI, but you can also go online and key in certain factors such as height, weight, age, and you can calculate your BMI and find out where you are as far as weight. Another risk factor is diet. We all know this, but I'm going to stress it again. A diet full of red meats, high-fat sides, dairy products. These things increase your risk of becoming overweight and leading to type 2 diabetes. We usually recommend a diet full of fruits, vegetables, whole grains, brown rice, oatmeal, nuts, beans, fish, and many other things like this can help reduce liver fat, even if it doesn't reduce your weight. Now, no one says don't eat any of these on the left-hand side of the slide because we all like good food. Just eat these things in moderation. Another risk factor that's very important are lifestyle choices. Alcohol is an increased risk of liver cancer because alcohol can lead to cirrhosis. So heavy drinkers are 5 times more likely to develop liver cancer. If you drink alcohol, the Center for Disease Control and Prevention recommends small amounts. They recommend not more than 1 drink per day for women and not more than 2 drinks per day for men. If someone uses IV drugs, try to avoid sharing needles. And also it's important to use properly sterilized needles when getting piercings and tattoos. If you don't use properly sterilized needles, you increase your risk of getting hepatitis C, which increases your risk of developing liver cancer. And then of course, smoking. We know smoking can cause lung cancer. It can also cause liver cancer, bladder cancer, heart disease, and many other health ailments that affect the community.
Alcohol, needle sharing, smoking. We'll talk about some of these as, again, risk factors for liver cancer. So this takes us to obesity. That's what we kind of talked about as well. We talked about that obesity can lead to type 2 diabetes and what's called NAFL, that non-alcoholic fatty liver disease, which again, the name has more recently changed to metabolic associated steatotic liver disease, but all the same. And some people just know it as fatty liver. So both of these are risk factors for liver cancer. How do you know if you're obese? Because, I live in Louisiana. So a lot of people in Louisiana are obese, but when we look at people, we don't necessarily consider them obese because that's just kind of how our body makeup can be in the South or Southeast. But in fact, there are real cutoffs that let us know if we're obese or not. One is body fat percentage. So the body fat percentage will vary between men and women in terms of obesity. So for men, if you have body fat percentage greater than 25%, you're considered obese. For women, it's greater than 33%. So, women, we're allowed to carry a little bit more weight, which is nice. But BMI, it doesn't change regardless of gender. So the BMI scale, 20 to 25 is considered a normal BMI. 25 to 29 is considered overweight. And then 30 to 39 or all the way up to almost 40 is considered to be obese. And then 40 or greater is considered morbidly obese. So it's really important to know your body mass index. You may not want to know because we may be in denial about what that is, but for your own health, not just as it relates to liver cancer, but we know that obesity is associated with a lot of other poor health outcomes. It is very important to know your body mass index. So if you don't know your body fat percentage or your body mass index, make sure that you see your doctor. And it's important to understand if you're in a normal body mass index, if you're overweight, if you're obese, or if you're more, excuse me, morbidly obese. So you really want to know your risk and take action. So this is just a nice summary slide. So think about yourself, think about your family, your loved ones, people in your community, think about diabetes, making sure that people have their blood sugars controlled is really important to reduce risk. We talked about hepatitis B. Even though it's not curable, it's certainly treatable, and you certainly want to know if you have it or not. Now, hepatitis B is not treated in everyone. So I want to say that. So your doctor would have to decide if you really need treatment or not. But certainly hepatitis B can increase the risk of cirrhosis and liver cancer. So you want to know your status. Hepatitis C certainly is easy to screen and diagnose and treatable and in fact curable, but increases the risk of liver cancer. Obesity through diet, right? We talked about less red meats, high fat dairy products, processed foods. You want more fruits and vegetables, things where you don't need to read a label to really know what's in it. Alcohol. So no more than one drink a day for women and two for men. Again, I live in the Southeast. I live in Louisiana. Everything is done around alcohol. And so our concept of what's, normal drinking is often skewed because in fact, for women, it's just two standard drinks. And so you have to make sure you know what a standard drink is, not a huge whole bottle of wine, like in one cup. It has to be kind of your standard drink, two for men, and only one for women. Needle sharing. So we still are seeing people get hepatitis C, as I mentioned, from sharing needles, especially with people who inject drugs in the opioid epidemic. But there's still homemade tattoos that are being done or tattoos that are done in incarcerated populations. So definitely, if you have any high-risk behaviors, make sure you're not sharing needles, using your own supplies if you are doing drugs, because there's an increased risk of hepatitis C transmission through injection as well as non-injection drug use. Smoking is a risk factor for a lot of things in terms of poor health outcomes. So really talk to your doctor about resources to help with quitting smoking. And then as we talked about ethnicity, being Black and African American. So you want to really feel empowered, to go to your doctor, right? You don't have to just let your doctor always set the agenda for your visits. I encourage each of you, if you have stuff going on that you're worried about, whether it's going on in your body or after seeing presentations like this that you're concerned about, go and set the agenda with your doctor. Say, hey, I heard that I could be screened for Hep B and Hep C, and make sure that you get that screening that you need. Hey, I want to know what my body mass index is. Tell me about some things that I can do to work on my weight. I'm having trouble stopping alcohol or smoking. Please provide me resources. So work with your doctor, get tested, and most importantly, get those risk factors under control so that you can decrease your risk or likelihood of developing liver cancer.